Thank you guys for staying around. I hope you are enjoying your time. So my next presentation is still talking about oral health. It will be way shorter, and it's going to be about how to keep a healthy smile, which is going to lead to a healthy life. I will just put some tips for a good oral health, and I would like to talk about the common dental problems that we all probably experienced, or maybe some of us are lucky not to have them. But I will talk about the problem and then maybe talk about the solution. So to start with, I will start with saying dental care is highly encouraged. It's very assuring that it gets installed in children, and it's going to be really important to start at a younger age. While there is no problem with brushing, which is kind of like, seen, flossing is less observed. So we definitely encourage more flossing. Both habits are important to avoid dental issues, but that's not the whole thing. I listed several dental problems that we probably commonly encountered, and what's going to be the easy techniques to avoid them. So I'm going to start with the most common dental problems that I see probably every day, which is tooth decay and cavities. It is one of the most common dental problems that we can encounter daily, and it is as common as flu or common cold. People will ask, why do I get a cavity? It's as simple as having plaque that will accumulate after having a meal on that tooth surface. This will lead to make some form of acid, and these kind of accumulated acids will subsequently cause the enamel, which is the layer of the calcified tissue that cover the tooth. It is the hard tooth structure. It will be kind of damaged and decayed, and this will cause cavities. Cavities could be small holes on the tooth, and sometimes could be even bigger holes. With basic oral maintenance, these can be easily prevented from happening. This will include regular brushing after meals and flossing, as we discussed. Again, I highly recommend using fluoridated toothpaste that will aid in hardening that enamel that we are talking about. What about the treatment? What's going to be the best way to treat those decay? We talked about prevention, but if we have already a decay that is existing, how we would manage that? Usually it will be depending on the severity of the damage. Sometimes you will be surprised that, hopefully not here in Canada, but in other parts of the world, you will see majority of kids, they have lots of cavities that will never be treated. And this is really sad. One method to treat those cavities, it will be the removal of the decay, and then replace the missing part with a dental filling that will replace the damaged and missing part. Sometimes if the damage is big, after doing a filling, we can suggest a crown that will be better in terms of protection. It will make the tooth harder, and it will be nicer and aesthetic. Sometimes a tooth decay can be so deep that it will lead to a damage in the nerve of that tooth. And if the nerve, or the pulp we call it, will get infected, root canal treatment will be necessary at that point. Moving from cavities to gum disease, and as I discussed in my first presentation, the gums are the tissues that will hold your teeth together. If you don't take care of your gums, they will be suffering from problems. And if those problems will be like affecting the gums, the teeth will be suffering as well. These problems, clinically we call them periodontitis, and usually we have two types of gum disease depending on the severity. So if it is less severe, it's called gingivitis, and it's a mild form of gum disease. It will be seen as swollen red gums that can easily bleed. If you don't get that treated, and it will last for a longer time, it will move to an advanced stage, which is called periodontitis. And that is when the plaque buildup will be moved past the gum line. That means that bacteria will just cause the gum and the bone supporting them to be damaged and deteriorate. The best way to prevent this is by proper oral hygiene, regular toothbrushing, and flossing. You have to make sure that after brushing, there's going to be no bacteria in your mouth. And this is going to be very important because the treatment of gum inflammation is really costly. The treatment usually start with like cleaning, and we call it scaling. If it is sometimes severe, we need to give some medications. Antibiotic can be used, and even surgical intervention sometimes will be required. What about bad breath? Bad breath is a problem that lots of people are concerned about. Medically referred as halitosis, it's usually an unpleasant odor in the mouth. Causes could be many, but it include lingering food particles from certain food like fish. Other causes could be more complicated, and it could be coming from a dry mouth and definitely poor oral hygiene. It is, as we said, like it's seen in many. Lots of people complain from bad breath, and there is many ways to address the problem and prevent it easily. The first way I will say, start by achieving and maintaining adequate oral hygiene. Brushing, brushing, brushing. Using a floss and mouthwash will be really a good way to start. As we said, make sure to remove the plaque. It's going to be the first step that you will advise anyone to start with. Adding on that, you can use a tongue scraper. This will help to keep the tongue clean, and no bacterial buildup will be allowed to form. Sometimes in a more complicated situation, we can see dry mouth that will cause bad breath. And in this situation, we need to address the problem, see why it's happening, and then there are going to be some recommendations that we can give that patient. One of them is going to be take too much water, add maybe lemon to your daily water. That will help to compensate for the dryness and help that condition. So talking about the dry mouth, I would like to mention maybe few facts about this condition, and it's called xerostomia, and usually happening because there is not enough saliva in the mouth. Happening because of a variety of reasons, and one of them that we encounter on sometimes dental practices is the intake of specific prescription medications. So if you are suffering from such a case, you need to see a doctor. You need to know what's happening, and they have to carefully look into your prescription medication to find out if you have a drug that is causing the condition. We have to consult the prescribing doctor and see if we can change it to another drug, and hopefully it can help. Sometimes it can help if it is in the beginning of the problem, but after like months and years, sometimes it's going to be really not working, even after stopping the medication. So saliva is very important to provide the necessary lubrication and the moisture that will be needed to protect your teeth. Highly recommended that you keep your mouth moist, drink lots of water. As we said, lemon could be added. If you have such a situation, consult your doctor and get the necessary advice. Moving to tooth or teeth sensitivity, it's an issue that also we see and we get lots of question about. And I will just touch base simply on this condition, saying that usually teeth will be covered by a layer called dentin. And when this dentin is intact, it's protecting the small nerves that we will have on the tooth structure. When this layer of dentin get exposed or receded, this will make the teeth very sensitive. This could be exposed due to different reasons. It could be eating specific kind of food. It would be coming from like erosion. Receding gums can add to the problem. So if you are having this kind of exposed dentin, meals that are hot and cold, it will not be enjoyed, like you will not enjoy your meal. So usually you can prevent this with good oral care. Going back again, brushing, flossing, less intake of sugary, acidic food could help in preventing the condition. And if it is happening already, you need a proper assessment by your dentist, and you have to identify the severity of the problem. And in a management, let's say, we will just identify what's happening in there. We can use sometimes a varnish to help, like, seal that area. And sometimes, like, we will do other treatment means to help reduce the sensitivity. While sensitivity is more noted in elderly, tooth erosion is going to be more seen among children. Usually this will affect the layer that is going to be the enamel, not the dentin. Usually acid contained in certain food and drinks like soda and juices can aggravate bacteria that will be already corrosive in nature and may cause the tooth enamel to thin out and will be having some erosion. Other causes, it could be digestive complications. So, like, if you have a problem with, like, stomach problems, like vomitings due to corrosive stomach acids. Brushing after meals is going to be one of the best solution to combat tooth erosion. And this will help to remove the bacteria and the leftover food particles, which will be covering the enamel. Usually, it's going to be a good advice to neutralize if you're going to be having any kind of acidic drinks. Take water. That will neutralize the acidity in the mouth, and it will help to reduce the risk. Some people will be advised to take, like, xylitol chewing gum. Being, like, in the orofacial pain, I don't recommend chewing gum at all, but it's one of the recommendation as well. One of the other problems that I have to add, and I've seen like increasing numbers of people having this issue, is the temporomandibular joint disorder. And we had a great lecture by Dr. Freezer in the morning, and it is usually involve the symptoms coming from the joint, the associated muscles, the orofacial tissues altogether. So I'm just gonna, like, maybe touch base on the grinding, just to keep it simple. So if we have involuntary grinding of the teeth during sleep, people will suffer from, like, like TMJ issues. As Dr. Freezer said, it's more common in women than men, and it is more associated with stress. So it's seen people usually will complain of that kind of facial pain, muscle tension. You will need to see a dentist to probably identify the problem and see how they can help you. Usually, if it is keep happening, you can see some damages on the teeth. Teeth will suffer from wear and tear, and this will be easily prevented if the problem can be identified, and then we can find what can be done to stop it. So what's going to be the simple recommendation that we will just go through together to probably have a better oral health, which is going to let us have a better life? So I will always say excellent oral hygiene. It will protect the teeth. It will help the gums, and it will keep your smile. And all these will be something that you can do. It's going to be easy. It's something that, once people will get used to it, it's going to be really easy to follow. So brushing always twice a day. I will say sometimes, if you can do more, it's better. But brushing twice a day can do the job. Using the brush, it's going to be, again, try to choose the right technique. Try to make sure that you will go in a way that all the tooth surface will be covered. Don't try to miss the gum line. I've seen lots of issues with people having a problem when they brush side by side, but the gum line will be kind of left behind. So brushing technique is important. As we discussed before, time is important. So spend good time with your brushing. Make sure you get that kind of silky smooth surface after you will be done. Yeah, floss is very important. Flossing is a very good habit to add to your daily technique. When you do the flossing, you try to hug the tooth, so you will get the floss. Try to make, we call it kind of a C-shape technique. Try to clean both surfaces when you are using it. At the end of the day, the flossing will keep your mouth very clean. Make sure it will be going to area that brush cannot reach. Moving to the from the brushing, you can clean the tongue. You can use the brush for that. I highly recommend using a tongue scraper. It will be nice to keep the tongue clean. And some people will ask, what about water flosser? Water flosser is excellent as well. There is lots of research regarding the good result noted after using a water flosser as well. You can use a floss and a water flosser. It is both are very effective. Mouth rinse, using an antibacterial mouth rinse every day is also a nice add to the oral hygiene routine that you will have. Choose your diet carefully. Your diet will be playing a big role in how healthy your mouth will be. Reduce your sugary intake. Reduce your sugary beverage. This is going to be probably the best thing you can do to yourself. Smoking is also something can impact the oral health badly. And I always tell my patients, if you don't smoke, please don't. And if you are a smoker, we just sit together and we discuss what could be done and how things will get better if you will stop. And the earlier you stop, the better it will be. And if you'll try all these preventative measures, It's going to be really helpful, and it will be better than having the problem and then dealing with fixing it later. I think I'm done. Thank you so much.